Hello, everyone. I hope you're all keeping well. I'm Dr. Amelia Wright, and I've been practicing medicine for over 25 years now. Today, I'd like to have a proper chat with you about something that doesn't get discussed nearly enough in polite company, but it's absolutely essential we talk about it openly and honestly. We're going to explore sexual abstinence, what it actually means for your body, and I'll be giving you the facts without any scaremongering or nonsense. So, let's settle in, shall we? Now, the term sexual abstinence can mean different things to different people, and that's perfectly all right. In the strictest sense, it means choosing to avoid any sexual contact whatsoever. But here's something important I want you to understand right from the start. Sexual abstinence isn't just for people who've never had sex. You can practice sexual abstinence even if you've had sexual relationships in the past. Many people choose to abstain from sexual activities for various periods of time, whether that's permanently or temporarily, and there are perfectly valid reasons for doing so. Let me run through some of the common reasons people choose abstinence. First, there's culture and religion. For many people, their beliefs guide their decisions about when and how to engage in sexual activity. Second, preventing HIV and other sexually transmitted infections is a very real concern. Third, avoiding pregnancy is important for many individuals. Fourth, in certain medical situations, men might be asked to abstain from sexual activity for anywhere from 2 to 7 days. For instance, when collecting a sample for in vitro fertilization, we want to ensure the highest possible concentration of sperm. A man might also need to abstain if he's suffered a penile fracture. Similarly, someone might abstain from regular sexual activities if they're dealing with a painful medical condition. And fifth, some people simply don't feel ready or don't fancy having sex at a particular time in their lives. They're not making this decision based on philosophical or religious beliefs. They just don't feel like it, and that's completely valid. So those are some reasons why someone might choose to abstain. Now, let's talk about what actually happens to your body when you make this choice. I'm going to be completely honest with you about both the potential concerns and the reality of the situation. I've seen countless patients over my 25 years in practice, and I can tell you that the human body is remarkably adaptable. Right, let's start with the first point, and this one's particularly relevant for the gentleman watching. There's research suggesting that abstinence from sexual activity might increase the risk of prostate problems, including potentially prostate cancer. Now, before you panic, let me explain what's actually going on here. This concern relates to the fact that abstinence leads to fewer ejaculations. A scientific study published in 2016 by the European Urology Journal found that regular sexual activity, specifically averaging 21 ejaculations per month, was associated with a reduced risk of prostate disease. The thinking is that ejaculation essentially cleanses the prostate, because seminal fluid, which is the liquid that sperm travels in, is produced by the prostate. When there's less frequent ejaculation, certain prostate conditions might be more likely to develop. But here's what I want you to understand. This doesn't mean you must have partnered sex. Masturbation, or self-pleasure as we sometimes call it, has the same effect. If you're abstaining from partnered sexual activity but still ejaculating regularly through masturbation, you're still getting that cleansing benefit. This is something many people don't realize, and it's an important distinction. The second point relates to erectile function in men. A study published in 2008 in the American Journal of Medicine found that men who engage in regular sexual activity had a 50% lower risk of erectile dysfunction. Now, researchers believe that regular sexual activity has a positive impact on erectile function. Sexual relations help maintain men's ability to achieve erections. If you've gone without sexual relations for quite some time, there might be an increased risk of developing erectile difficulties. However, and this is crucial, when I say sexual activity, that includes masturbation as well. Your body doesn't distinguish between partnered sex and solo sex when it comes to many of these physiological benefits. The key is maintaining some level of sexual function rather than complete inactivity. Third point, and this one's for the ladies. Women who abstain from sexual activities might experience difficulties or a slowing down of vaginal lubrication, as their sexual organs aren't being regularly stimulated. According to scientific research, the regularity with which these activities occur is important for the production of vaginal fluids. This means that lubrication might take longer after a period without sexual activity. When you resume sexual activity, the vaginal tissue might not be accustomed to relaxing during penetration. You might feel like the walls of your vagina have become tighter. Now, this is perfectly normal after a period of abstinence, and it'll take some time for everything to return to how it was before. Let me pause here and address something directly, because I've had patients come to me with concerns about this. Ladies, if you've been sexually active before and you're practicing abstinence now, your vagina isn't going to somehow seal itself shut or become permanently different. The vagina is a remarkable organ that's self-cleaning. You don't need to do anything special to maintain it during a period of abstinence. Some women worry that they need to use fingers or other objects to keep the vagina open during abstinence, but that's absolutely not necessary and can actually be counterproductive. The vagina naturally maintains itself through its own secretions and muscle tone. When you do become sexually active again, yes, there might be an adjustment period where you need more time for arousal and lubrication, but that's temporary. Your body will adapt. Using plenty of water-based lubricant when you resume sexual activity can help enormously during that transition period. The fourth consideration is about libido, and this one can go either way. Sexual abstinence might either increase or decrease your sex drive. During sexual activity, the body releases hormones, particularly endorphins. These hormones create feelings of well-being, which is why sex is often associated with positive feelings. When these hormones aren't being released regularly, you might feel less sexually active and have a lower libido. However, some research suggests the opposite, that abstaining from sexual activity can actually increase our libido because we're constantly thinking about it. This is one reason why maintaining sexual abstinence can be quite challenging. It's difficult to abstain from sexual activity when you're thinking about it all the time, particularly if you've been drinking alcohol or using substances that lower inhibitions. According to research, sex helps regulate libido, which naturally fluctuates. Researchers believe that your level of sex drive is largely determined by your sexual experiences and current circumstances. Now, the fifth point is about immune function. And I need to be careful here because there's been some exaggeration about this in various sources. Researchers at Wilkes University in Pennsylvania conducted a study with 100 students. The study showed that sexual activity twice per week was associated with higher levels of immunoglobulin A, an antibody that's part of our body's first line of defense against bacteria and viruses. The increase was around 30% in those who were regularly sexually active. However, I want to be very clear. This doesn't mean that abstaining from sex will make you seriously ill or dramatically weaken your immune system. Your immune system is affected by many factors, including diet, exercise, sleep, stress levels, and overall health. Sexual activity is just one small piece of that puzzle. If you're living a healthy lifestyle otherwise, abstaining from partnered sex isn't going to leave you vulnerable to every infection going round. The sixth concern involves cardiovascular health, and this is where we need to have a sensible conversation. Sexual activity and cardiovascular health are connected. To engage in sexual relations, you do need to be in reasonably good cardiovascular health, because sexual activity is similar to other forms of physical exercise. During sexual activity, adrenaline is released, which increases blood pressure and heart rate. Your heart and blood vessels adapt to these sudden changes during sex or physical activity when you're regularly active. Now here's where I need to be straight with you, particularly for those of you who have existing heart conditions or high blood pressure. If you've been abstinent for a long period and you have cardiovascular disease, you need to take sensible precautions before resuming sexual activity. I'm not saying this to frighten you, but as a doctor with over 25 years of experience, I've seen situations where people haven't been careful. Before engaging in sexual activity with someone who has heart disease or high blood pressure, you need to ensure their condition is well managed and stable. If someone has uncontrolled high blood pressure, the sudden increase in heart rate and blood pressure during sex could potentially trigger problems. But let's put this in perspective. This isn't about sexual activity after abstinence being inherently dangerous. This is about the importance of managing chronic health conditions properly. If you have heart disease or hypertension, you should be working with your doctor to keep these conditions under control regardless of your sexual activity. A well-managed heart condition or blood pressure doesn't mean you can't have sex. It means you need to be sensible, take your medications as prescribed, keep your follow-up appointments, and know your limits. The same advice applies to any form of physical exertion, whether that's sex, climbing stairs, or doing the gardening. The seventh point is about stress management. Sexual activity does release endorphins, those feel-good hormones that help the body manage stress. During periods of abstinence, you're not getting that particular stress relief mechanism. However, there are many other ways to manage stress effectively. Regular exercise, meditation, spending time with friends and family, pursuing hobbies you enjoy, getting enough sleep. Sex isn't the only way to release endorphins. A good laugh with mates, a vigorous walk in the countryside, or even eating a bit of dark chocolate can trigger endorphin release. So while sexual activity can be a stress reliever, its absence doesn't doom you to a life of unmanageable stress. The eighth and final point concerns self-confidence and mood. Regular sexual activity can contribute to feeling good about yourself and feeling attractive. A period of abstinence might mean you're missing out on that particular confidence boost that comes with regular sexual activity. However, self-confidence comes from many sources. Achievements at work, maintaining good relationships, taking care of your health, learning new skills, contributing to your community. Sexual activity is just one potential source of positive feelings about yourself. Now, I want to take a moment to address something that's come up time and again in my practice. I've had patients, both men and women, who've been abstinent for years, sometimes decades, and they're perfectly healthy. One patient of mine, a lovely woman, hadn't had partnered sex in 14 years when she came to see me for a routine checkup. She was worried that something must be wrong with her body. I examined her, ran all the appropriate tests, and you know what? She was in excellent health. Her blood pressure was good, her cardiovascular health was fine, and she reported feeling generally content with her life. The absence of partnered sexual activity hadn't damaged her health in any meaningful way. This is what I want all of you to understand. Whilst there are some potential physiological considerations with long-term abstinence, particularly regarding things like prostate health in men or vaginal tissue elasticity in women, the human body is remarkably resilient and adaptable. Most of the concerns I've discussed today can be addressed through other means. Masturbation provides many of the same physiological benefits as partnered sex. Regular exercise, good nutrition, adequate sleep, and stress management support your overall health regardless of your sexual activity level. The decision to be sexually abstinent is deeply personal, and it's influenced by countless factors: your values, your circumstances, your health, your relationships or lack thereof, your religious or cultural beliefs, or simply what feels right for you at this point in your life. There's no single correct answer that applies to everyone. What matters is that you're making informed choices and that you're taking care of your overall health and well-being. If you're choosing abstinence, that's absolutely fine. If you're sexually active, that's fine too. If you're somewhere in between, that's also perfectly all right. The key is understanding your body, listening to what it's telling you, and not letting fear or misinformation guide your decisions. One more thing I want to emphasize. If you do return to sexual activity after a period of abstinence, be patient with yourself. Your body might need a bit of time to readjust. Things might not work exactly as they did before straight away, and that's completely normal. Communication with your partner, if you have one, is essential. Take things slowly, use lubricant if needed, and don't put pressure on yourself to perform perfectly. Your body will remember what to do, I promise you that. Throughout my 25 years practicing medicine, I've learned that people worry far too much about what's normal when it comes to sex. The truth is, there's an enormous range of normal. Some people have sex multiple times a week, some have it once a month, some go years without it, and some never have it at all. All of these can be perfectly healthy choices depending on the individual and their circumstances. What's not healthy is feeling pressured into sexual activity you don't want, or feeling abnormal or defective because you're not sexually active. Sex is a part of life for many people, but it's not the only important part, and it's certainly not worth sacrificing your mental health, your values, or your sense of self over. So there you have it. I've given you the medical facts about sexual abstinence without the scaremongering. Yes, there are some physiological considerations to be aware of, particularly for men regarding prostate health and erectile function, and for women regarding vaginal lubrication and tissue elasticity. But these concerns need to be kept in proportion. They're not catastrophic, they're manageable, and many of them can be addressed through masturbation or other aspects of a healthy lifestyle. Your sexual choices are yours to make, and whatever you choose, I hope you make those choices from a place of knowledge rather than fear. If you have specific concerns about your sexual health, have a chat with your GP. We've heard it all before, I promise you, and we're here to help, not to judge. Take care of yourselves, all of you. And remember, whether you're sexually active or abstinent, what matters most is that you're healthy, happy, and living authentically according to your own values and circumstances. That's what I've learnt in my 25 years of practice, and it's served my patients well. Thank you for watching, and I'll see you in the next video.